Hello, I'm Dr. Ken Landau. Thanks for joining us. Let's talk about viroxetine. Viroxetine, commonly known as Trintellix, is a drug that's used to treat major depressive disorder. I'm depressed, so you go and take a pill. It was initially approved in 2013 by the Food and Drug Administration. Costs a lot of money, costs about $10 or more a pill compared to a generic drug that you could take for $3 to $10 a month. Now, major depressive disorder is extremely common. Thought if you look at people in family doctors' offices, somewhere between 5 and 10% are suffering from major depressive disorder that we'll simply call depression. If we look at people who are hospitalized, the number increases to 10 to 15%, and it's even higher among the elderly. Now, depression isn't the disease that's commonly bandied about when someone says, I'm depressed. No, depression is a specific medical condition that requires specific criteria. The criteria include low mood and sadness, loss of interest, maybe lack of energy, you're tired but you can't sleep and you have a change in your appetite, your weight goes down, your sleep patterns are completely different, difficulty concentrating, you feel that you're guilty of things or worthless. Some people have suicidal ideas, they want to kill themselves. And in rare cases, they can suffer from delusions and hallucinations. Now, it's important to realize that bipolar disorder combines depression and mania. It is not for people who suffer from bipolar disorder. It can actually make mania worse. Now, to the general public, the drug was launched in mid-2016 with a barrage of ads. First, just to make you aware of depression, there were ads that didn't mention the pill. The ads were for lighterblue.com. You go to the website and learn about depression. Subsequently, they started advertising by name. The company, after they got the approval for treating major depressive disorder, wanted a change in the label. They said it gave your brain a boost in its power, in its abilities. It helped you think. It helped you pay attention. It helped you make decisions. The FDA said, no, it doesn't. So as a result, it's only for treatment of major depressive disorder. It was actually originally known as Trintellix, but there is another pill on the market known as Brilinta, and Brilinta helps make your blood not clot, sort of like Coumadin, one of those blood thinners. So they had to change the name so there wouldn't be any confusion at the pharmacy. So now it's known as Trintellix. You take the drug once a day, take it without food, take 10 milligrams a day as the starting dose. If necessary, you can increase it to 20 milligrams, or if it seems like it's working very well, you can try going down to 5 milligrams. Fortunately, this is one of the drugs that you can discontinue abruptly if you would like. On the other hand, if you're taking a higher dose, it's probably better to cut it in half and then take that for a while and then discontinue it. Otherwise, you might have a rebound headache or some dizziness, some muscle disorders, and outbursts of anger. Now, it's a treatment for major depressive disorder, but it doesn't work right away. It takes about 2 weeks to start working and then reaches its maximum after about 6 to 8 weeks or even several more months. And you probably have to take it forever in order to prevent depression from recurring, because depression is a recurrent condition. It has some side effects. Somewhere between 10 and 20% of the people who take the drug initially are going to suffer from nausea. Even after taking it for several weeks, still about 1 in 10 people suffer from nausea. Then there's vomiting and constipation and flatulence and sexual dysfunction in men. And because the drug works on a chemical known as serotonin, you could have too much serotonin in the system, and then that might cause the serotonin syndrome, where you have nausea, vomiting, fever, you can have sweating, your heart rate can go up, you can be severely agitated, have a change in your mental state, even have hallucinations or go into coma, something that's obviously quite important. There are some people who, especially when they take aspirin, suffer from some bleeding episodes. And we know that the drug isn't for those people who have manic episodes. Remember I said bipolar disorder combines with mania. But sometimes you just suffer from depression, and it originally, when you see the doctor, doesn't know that it really is associated with this bipolar disorder, so you take the pill, then you might have an increase in energy, trouble sleeping, racing thoughts, you might have some behavioral disorders, behave recklessly, and you talk faster than normal. In some people taking the drug, the sodium goes down, and that can lead to headache and difficulty concentrating and memory loss and confusion. And some people with the drug can suffer from vision problems from reddening of the eyes to dilated pupil to pain in the eye, and even suffer from attacks of glaucoma. You have to be very careful if you're taking the drug and taking certain other kind of drugs not to be combined with fentanyl or tricyclic antidepressants, the older kind of antidepressants, not for people who are taking lithium or St. John's wort, people who are taking Buspar, and it's not for people who have migraine headaches and are taking the triptans. It's not for women who are pregnant, not for women who are nursing, and the drug carries with it a black box warning saying that suicidal thoughts and actions might occur, especially in children or teens or young adults who are taking the drug, or in people who have recently had a change in the dose of the drug, and as a result, it's not for people who are under the age of 18. Now, the trials have mostly been done in people with moderate depression, not severe depression, and while it's statistically significant, the benefit that the people get, it's very difficult to realize whether it's a clinically significant improvement. How does it work? It boosts the serotonin in the brain, and it works just like other drugs in the same family, drugs that are much cheaper, drugs that are generically available, drugs like Zoloft and Prozac and Paxil or Lexapro. There are a variety of other drugs that can be used to treat depressive disorders. Matter of fact, in June of 2015, the drug was brought before the British regulatory authorities, and they said, nah, the drug really doesn't provide any special benefit. It's no better, it's no worse than lots of the other drugs that we have on the market. But as a result of lobbying by the company, they changed their mind in November of 2015, but said you had to go and take at least 2 other antidepressants first and have them not be effective before you could take this drug. And in the United States, most of the insurance companies require other antidepressants, often in the same family, before you can take Trintellix because it's just so expensive. The price for 30 tablets, either 10 milligram or 20 milligram, cash price is $400. You can get some of the other similar drugs, same family, for $3 to $10 a month. So with relatively little added benefit, significant risk, since it's no better than other cheaper medicines, well, how do we rate it? Well, for cost, it's ridiculous. The price is absolutely out of the ballpark. On the other hand, how do we rate it for effectiveness? It's okay. It's nothing special. So anyway, thanks for joining us. I'm your host, Dr. Ken Landau.